Member for Joondalup.
But left, I just want to say right from the outset, I don't for moments subscribe to the ridiculous scaremongering put forward by the opposition in relation to health services. We just have to look at Joondalup and the Joondalup community and how well served we are by the State of the Heart Hospital run by Ramsay Health through a very successful public-private partnership. And you talk about budget impacts and you talk about the impact on service delivery. And let's have a look at Joondalup. I get positive feedback day after day in relation to the satisfaction that my community feels in relation to the services being delivered by Joondalup. So you see, the Joondalup community has nothing to be worried about under the leadership of this government and this Minister for Health. But I do tell you what worries the Joondalup community, and I tell you what worries me as their representatives, and that is the policy position of the WA Labor Party that would see the current operating model at this successful hospital turned on its head. You talk about impacts on budget and you talk about service delivery. Well, let's have a look at this. The WA Labor in your 2015...
Right. Member for Mandurah. Member for Mandurah. Call you to order for the first time. Give the member a chance. Member.
This is my... You don't like what you're going to hear. You don't like what you're going to hear.
Right, member for Butler, member for Mandurah for the second time, member for Butler for the first time. We've had a reasonable debate thus far. Member for Joondalup.
You might not like what you're about to hear, but the bottom line is...
Sit down. Member for Butler, call you to order for the second time. Right, member for Joondalup.
The bottom line is the party opposite in your policy position is you want to not renew any privatised contracts with any hospitals. You want to negotiate an early release from the contracts. How much compensation will you need to pay? How much compensation will you need to pay to Ramsay Health to bring that back under the public service? What will that do to the staff of the Joondalup Health Campus who are happily employed there? And why? And the real question is why? What is so wrong with the Joondalup Health Campus? What are they doing wrong that they've gotten your Well, let's have a look at this. There's publicly available KPIs. And in relation to infection rate, the Joondalup Health Campus performs 4 times better than the public rate. In relation to patient falls, it performs twice better. Unplanned return to theatre, 2 times better. Unplanned readmission to hospital, 11 times better than the public peer rate. Medication safety errors, 4 times better. Patients developing pressure injuries, 3 times better. So
Sit down. Right. Member for Armidale, call you to order for a second time. Member for Joondalup.
So clearly what you're saying is that you don't want the people of Joondalup to have outstanding health services. You want to bring them into line with the public average rate. So you actually not only want to throw money out the window by compensating a private company, you want to see the service delivery in Joondalup drop. Why does the WA Labor Party hate Joondalup? Why does the WA Labor Party hate the people of Joondalup? Why do you hate them? At the moment, they've got an outstanding model that is supported by this government. We support the private-public partnership that is delivering outstanding results, and in your policy platform, you will turn that on its head. You're going to throw money out the window, compensating a company for early termination, and you're clearly saying you're delivering too good a result for the people of Joondalup. Well, maybe, member for Rockingham, you're not happy with that. I tell you what, the people of Joondalup are happy with that, and they will remember that. I will remind them of what your policy position is.
Right, the question is...